So we're down to the late afternoon session. Thank you all for staying. I'm excited to have a chance to introduce the next two speakers. The first one is Dr. Mary Manspeaker. She's going to talk about the veterinarian's role in animal abuse investigations. It's my pleasure to introduce Dr. Mary Manspeaker, who is the Veterinary Medical Director for Memphis Animal Services. This is an open admission municipal shelter. You said it handles about 9,000 to 10,000 animals a year. It's in her hometown of Memphis, Tennessee. She frequently provides counsel on cruelty cases and performs forensic examinations as part of her daily work. Prior to her current appointment at MAS, she worked for the ASPCA on many large-scale cruelty cases, and she continues to work with the Animal Rescue Corps whenever time allows. In her spare time, Dr. Manspeaker is working towards a master's degree in veterinary forensic sciences through the University of Florida. She travels with Animal Balance to provide wellness services for the animals of island nations. And by the way, she just came back from the Galapagos. And she enjoys her family, including 5 cats and 1 dog. So, Mary, thank you for coming.
Thank you, Kathy. Can everybody hear me? No? No?
Push it and hold it.
How's that? I think I just turned it off. How's that? There we go.
Yeah.
All right, is that good? Everybody hear me? If I start getting lower, please just give me a thumbs up or something. Thank you, Kathy. Thank you, everyone, for, I'm going to take this off a little bit. It seems to be better. Thank you for having me here. This has been such a treat to come up, even in November in Michigan. My teeth start chattering, I apologize. Now I'm going to do it today. I think it's this. Let me set this up here and see. I'm just going to hold it and see if it works. Is that okay? No? Sorry. Okay, all right, so I'm going to talk about the veterinarian's role in animal cruelty investigations today. So possible scenarios that you may encounter for cruelty investigations is you may have 1 or a few animals present to you at a private practice or at an animal shelter, all the way to tens to even thousands of animals in the field on a cruelty scene, a crime scene. Examples would be a hoarding situation, an animal shelter or sanctuary that has become overwhelmed, a puppy mill operation, a dog fighting or cockfighting operation. I was once involved with a cockfighting operation where there were 4,000 birds. It was really loud. And that was actually in a temporary emergency shelter, and so that's another possible scenario. You may come on board a little bit later after the animals have been seized and moved to an emergency shelter. This is a picture of a recent hoarding case in Memphis. So why are vets needed for cruelty investigations? There's a lot of reasons. 1, we are needed to perform triage on scene. Oftentimes with these cases, there's some sick animals on the scene, and veterinarians are needed to go through and assess whether or not those animals need emergency care. We are needed to collect and document evidence. This evidence includes environmental evidence that may be found on scene, live animal evidence, and also deceased animal evidence. We are needed to provide health certificates if the animals have to leave the state where they are seized. We're needed to provide preventative care and medical care. We're needed to refer. We are needed for euthanasia. We're needed to write the veterinary forensic report, and we are needed to testify in court. The veterinarian's role in a cruelty investigation is to provide accurate and objective documentation and interpretation of the evidence. The courts will decide guilt or innocence based on that evidence. That's important to remember when you're involved in one of these cases. So what is expected of veterinarians in a cruelty investigation? Some states require that veterinarians report cruelty. Tennessee is not one of those states. Michigan, not either, right? But you are given immunity if you do report it, correct? Yeah, we're not in Tennessee. We're kind of on our own. But that doesn't really prevent most of us from reporting. But sometimes you are mandated by law to report cruelty, depending on the state in which you practice. There's a large time commitment that comes with being involved in cruelty investigations, depending on the number of animals and the circumstances surrounding that and where you have to go. So it's always important to get an idea. If someone asks you to help with one of these investigations, you need to kind of get an idea of what they expect of you regarding time. You need to find out where the case is going to be and so you can let them know whether or not you're licensed. I've had rescue organizations call me and say, can you come help us with this case? And then they tell me where it is, and I'm like, well, I'm not licensed there. And I've even had one tell me, well, that doesn't matter, you could come. And and no, I really couldn't come. Actually, I did go, but all I did was to coach the licensed veterinarians on how to take forensic photographs and kind of just walk them through the steps of a forensic exam. But I couldn't practice, I couldn't examine, I couldn't diagnose in that state. So always make sure you know where the case is going to be before you agree to get involved. If the animals are going to have to be moved out of state and they need you, make sure you understand, or they understand whether or not you are accredited, because that can determine whether or not you're going to be able to help them. And if they need controlled drugs, make sure that you can help them with that. Make sure that you have drugs that are registered to your name and that you are able to transport them to wherever the scene is. I'll get into that a little bit more later. Ask questions about what species are going to be involved. I put this big Galapagonian tortoise on here because if we had a case somewhere with tortoises, I would say I don't know anything about them, so I can't be there. Plus, I couldn't resist putting a picture of tortoises on there, so I just got back from the island. So make sure you know what species are involved before you agree to be a part, because if you're not an equine vet and it's an equine cruelty case, you're not going to be able to help as much. Can you guys hear me? Still. Sometimes we are expected to euthanize animals that are involved in these investigations, and sometimes it actually requires entire depopulation of a lot of animals. So that is something that you need to get an idea of whether or not that's a possibility, and you need to be able to tolerate that. Sometimes, some people are not, that wouldn't interest them. So some veterinarians just can't stomach that. Post-mortem exams are sometimes requested of veterinarians. Veterinary forensic reports. If you are one of the key veterinarians in a cruelty investigation, then you're probably going to be the one that's going to have to write the veterinary forensic report. This can be extremely time-consuming depending on how many animals are involved. And then, of course, testifying in court. Again, if you're one of the key veterinarians, you're probably going to get called to testify in court. So make sure you're comfortable with that part of it as well. If someone calls you, if a rescue organization calls you and asks you to be involved in a cruelty investigation, make sure that you are briefed on the agreement between all parties involved. This includes the local law enforcement, the rescue organization, and anyone else who may be involved in the case. Understand what the warrant allows. If it's primarily a dogfighting case, when you get on scene, there may be other animals that are not part of that warrant, and they may not be able to take them. So just before you jump headfirst into one of these, just make sure you understand what all's involved. Understand what procedures can be performed. Most of the time, these animals are seized, and then they are just simply under the care of the rescue organization until the courts decide or until the owners surrender them. So there's certain things that can't be done to them. There basically has to either be just basic medical care or life-saving measures. They can't be spayed and neutered, they can't be microchipped. So understand the limitations. Understand what happens when an animal needs to be referred, and where are they going to go? Where are they going to go for after-hours emergency care? What is the process if euthanasia is the recommended outcome? These are things that you don't want to just make that decision on your own. You want to take it up the chain of command. You want to make sure that if the defense has to get involved, if the judge has to give permission for that, make sure that that has occurred before you euthanize an animal as part of a criminal investigation. If you're a veterinarian that's called to help a rescue organization, this really shouldn't just all fall on your shoulders. You should be able to go to the next person up the chain and get more information and have that person come back to you and say, we've been granted permission to go forward with the euthanasia. Understand and review your Veterinary Practice Act before you get involved with a cruelty case that's going to take you away from your normal day-to-day work. Most of us go through our day-to-day work and we don't really think a whole lot about our Practice Act, but if you're going to be doing something that's a little bit out of the normal, you might want to just talk to your board and say, I've been asked to help with this. Are there any specific rules I need to know about? Especially if there's going to be a temporary emergency shelter involved. Most states require that even a temporary emergency shelter have a permit. And sometimes you may be the veterinarian that the rescue organization asked to be on that permit. So your board needs to know about these things. Of course, when you call the board, you want to be mindful of any case confidentiality. You don't want to reveal too much before the warrant is served. If you are asked to put your name on a temporary emergency shelter permit, then make sure you are aware of the rules that go along with that. Sometimes these permits require that the veterinarian whose name is on the permit actually be there. Maybe not every day, but at least regularly throughout that entire sheltering operation. And also when that shelter is closed at the end of that operation, there are things you have to do in order to get your name off of that and to say that the facility is now closed, because that can come back on you later if it's just kind of hanging out there. Know who can do what procedures varies from state to state. Sometimes veterinarians have to even place microchips. I don't know what the rule is in Michigan, but yeah, with some states, you can't even let a veterinary technician put a microchip in. So, controlled drugs. If you are asked to bring controlled drugs either to the scene or to the emergency shelter, I think you should talk to your local DEA office. If you read the Vet Mobility Act, it seems to sound like you can take your drugs across state lines as long as you're licensed in each state where you're taking them. Not necessarily true. I was involved in a case in the state a few years ago where I needed 3 veterinarians to bring their own controlled drugs because we had 3 different scenes. And one of the vets who was licensed in 2 conjoining states, she thought, well, I can just bring my drugs over to the scene in this other state. She called the local DEA office in her state and they said, no, you can't leave the state with your drugs. About a year later, I was at a lecture at an animal welfare conference where they said, yeah, you can bring your drugs. If you're licensed in both states, even though your drugs are registered in this state, you can take them across state lines. But I wouldn't trust that. I would call your local DEA office and ask them, what can you do? Prescription drugs, sometimes temporary emergency shelters have laws that say that even just prescription drugs cannot be stored there. So if those drugs are ordered under your name, so make sure you understand the rules there as well. So I'm going to walk through a typical animal cruelty investigation, and this is assuming that it's going to start in the field on a crime scene. If you are asked to be one of the key players, insist on being on scene. Just tell them, I want to be there, I've got to be there, because you will get a lot more information about the animals. You will be able to gather a lot more valuable evidence if you're actually on the scene and you get to see where those animals were housed, whether or not they had appropriate food, water, shelter, etc. So just let them know, yeah, sure, I'll help you, but I want to be there for the serving of the warrant and the seizure of the animals. Find out what will be available to you. What kind of record-keeping system is there going to be? Sometimes, depending on what organization you're working for, they may have a very sophisticated electronic medical record system, or they may rely on you to bring those exam forms. So find out what's going to be available and whether or not you need to create your own forensic exam forms and bring them with you. Will there be a triage station? And this, I've had situations where there's nothing more than a plastic tote filled with medications, all the way where there was a very state-of-the-art mobile veterinary clinic on the scene. So understand what you're going to be, what you're going to have access to, what medications are going to be there, whether or not there's going to be any kind of a climate control facility, like if you're working in the middle of the summer, what are you going substances coming from and what will they be. And very importantly, if you get to the scene and there's a critical animal, where's it going to go and who's going to take it there? I mean, these are things that you want to ask before you get there. Step 2, once triage is complete, the animals are all pretty much stable, then you're going to be walking through and you're going to be taking field notes. Again, are the field notes a form that's going to be provided for you, or are you going to need to provide those forms? Remember that animals are evidence, so everything you're seeing, it's nice to document it. It's important to document the conditions of the animals on scene, including whether or not there's shelter present. Is it clean? Is it dirty? Is there food and water available? Is it edible if it is available? Is it moldy? Is the water potable? Is it accessible? I recently was a part of a case where we had a whole room full of puppies, and there was one of those big construction buckets filled with water in there, but they couldn't reach it. They were too little, so it wasn't accessible. Look at the fecal quality on scene, and I always like to try to gather samples of fecal material on scene. Sometimes the warrant will not allow you to do this, so it's something you might want to ask in advance whether or not that will be included in the warrant. Especially in dogfighting cases, because dogfighting cases, they have to keep all the dogs separated from one another, and so it's really valuable and easy to collect individual fecal samples from each one of those dogs, and that way you've already got that material. You can get it packaged up, logged, sent off to the lab for analysis, and then you don't have to worry about waiting to collect that before you get to deworm all those animals. Very importantly, look for evidence of infectious disease. And look around to see what kind of medications were on that scene. What were they using for the animals? And were there any veterinary records? These things are very important when it comes to trying to figure out how these animals were cared for and why they are in the state they're in. That's another picture from that hoarding case, and all in the corner there is cat litter and cat feces. So continuing on with field notes, remember when you've got a large group of animals, whether it be dogs, cats, or what, it's herd health and you have to employ shelter medicine. So again, on-scene recognition of infectious disease is extremely important. And they need to be flagged appropriately. Again, depending on the organization you're working for, there may already be a flagging system in place. Or you may be the one that has to determine the flagging system. Duct tape works nicely to flag animals in the field using a specific color for specific things. I think blue is often used for infectious disease. I always liked writing why it had a piece of blue tape on it, like the animal's enclosure has a blue tape. Well, why? Is it gastrointestinal? Is it a parvo suspect? Is it because of skin infection? Is it a respiratory illness that you're concerned about? So that way it's easy to see, okay, it's an infectious suspect. Which isolation are we going to put it in when it gets to the shelter? If you see anything that looks infectious, there should be a person that's in charge of the actual sheltering operation that should be notified so that they can make plans for that animal to be transported from the other animals separately, and once it arrives at the shelter, it can be isolated appropriately. Parvo tests are an easy test to bring to the scene. They're very easy to run in the field, so ask and see if they will be provided. If not, maybe try to bring your own. Sometimes there will be deceased animals on scene, and sometimes you will be approached by the rescue organization and asked whether or not you think this deceased animal should be sent off for a post-mortem exam. Me personally, I would always say yes. Yes, send them off, because I'm not a pathologist. I'm not going to be able to look at that animal right there in the field and determine whether or not it's going to provide valuable evidence for the case. So the answer would always be yes. And usually the next answer is, well, how do we package it up, doc? And so brief yourself on the best ways to package up deceased animals to be submitted for forensic necropsy. Sometimes they'll need to be frozen if it's going to be several days between when they're seized and when they are sent to the lab. Sometimes if it's close to a veterinary school with a pathology lab, it can just be driven right there, right then, which would be great. So think about these things. Forensic necropsies should be sent to a pathologist. Do not offer to perform a forensic necropsy if you are not experienced and comfortable doing it. Step 3, transport to the emergency shelter. Usually in these cases that begin on a crime scene, the animals are actually transported to a shelter. It can be a regular shelter, it doesn't have to be an emergency shelter, but to some shelter the animals are going to be transported. So if it's within the same state, they won't need a health certificate. They are loaded up and they are taken to the shelter. If it's outside the state, a health certificate will be needed, and vaccines and tests according to the destination state will be needed as well. So again, if you are one of the key veterinarians, make sure you know where the animals are going to be going, and make sure you understand what is needed for them for the health certificate. Do not ever issue a health certificate for a sick animal. Make sure there is a plan in place for leaving animals behind for treatment. The last thing you want to do is sign off on a sick animal, put your accreditation at risk, put your license at risk, but more importantly, put that animal at further risk. When it's already sick, it doesn't need to be put on a long, lengthy, stressful transport to an emergency shelter. It needs to go directly to a local facility where it can receive the appropriate care, and then it can be later transported to the emergency shelter once it's well. Step 4, forensic examinations. Sometimes forensic examinations have to start in the field. This is, in my experience, is rare. Thank goodness, because it's not easy to do that, to start your exams in the field, especially when it's pouring down rain. Most of the time they're at the shelter, they're settled in, and then you start your forensic examinations, usually the following day, depending on how easy, how quickly they arrive. But the first thing you want to do when you start your examinations is you want to obtain photographs prior to doing any kind of procedure. So before you draw blood, before you trim toenails, before you shave any mats, before you put eye medication in eyes, take photographs first, as long as you can do so without making the animals suffer unnecessarily for a longer period of time, of course. But you want those animals to be in as close to the same state they were in when they were seized, when you start taking your photographs and when you start doing your forensic examination. So the type of camera that's recommended is an SLR, or single lens reflex, which is more than I understand about cameras, but basically what I do understand about that is that type of camera is going to give you the most clear picture of what you're looking at and without any distortion. If all you have is a point and shoot, then that's better than nothing. If all you have is your cell phone, that's better than nothing. But if you really try to get a good camera so you can take some really good photographs. Never ever delete photos. There should be a sequence of photos for each individual animal. You don't ever want to delete any of them, even if they're horrible and unreadable and nothing but a big blur. There should never be a break in that sequence. And then there should be a photo evidence form for these photos to be logged on. That may or may not be your responsibility, depending on what organization you're working for, but if you are the main person, then every one of those photos that are taken really should be logged on a photo evidence form as well, with a description and a date taken and all of that. Sorry. Okay, so this is a kind of just showing you some overall photos of a forensic examination. So every animal that you do a forensic exam should have a minimum of 8 photographs taken. And starting with over in the upper left-hand corner, that's just a photo board. Every animal should have a photo board. And the photo board should include the date, the animal's identification number, the case number, if there is a case number, the location that the exam is being performed, and the photographer's name. So you want to get a photo of just that photo board with all that information, and then you're going to get a picture with the animal with the photo board, usually from a headshot, and then you can put the photo board down, and you take a series of photos of every side of the animal as if it were a cube. So you're going to do front, side, back, the other side, the top, and the bottom of the animal. Every single animal should have a minimum of 8 photos. This 9th photo down here, I just put that in there because this was a starvation case that we had recently, and I liked that oblique view to kind of show the bony prominences a little bit more. Yeah, so your 8 minimum photos. Remember when you're doing forensic examinations that anything you remove from the animal must be logged as evidence. And this includes blood, feces, urine, hair mats, toenails, teeth, collars. Anything that comes off that animal needs to be put onto an animal evidence log and put into the proper packaging and sealed with tape and signed and dated. This dog in this picture came into our shelter a few months ago, and this was actually not a criminal cruelty case. I mean, it was a cruelty case, but we didn't know who to blame because he was stray off the street. But if this had been a real case that I could have pursued, I would have put all that hair in a big bag and I would have kept it. And so if you're in charge of one of these cases at your own shelter, make sure you got room for a bunch of evidence bags because you may have to hang on to them for a long time. Anyway, this little dog went on to find a great home, so. Forensic examinations continued. Again, you may or may not be provided with the forms to document your findings. I created this form myself. Can you read that? That looks kind of weird over here.
Not really.
Yeah. Anyway, it's basically just an exam form that's very, very thorough, and it's not showing up properly at all. But if you have to create your own form, make sure that you've got every body system listed so you don't forget anything. You want to, that is not at all what my exam form's supposed to look like. I don't know what happened to it. It's supposed to have a little diagram of dog and a cat at the bottom, and the different diagnostics that are done on the animals and the treatments and all that. But basically, the bottom line is make sure the exam form that you are using is very thorough, that it has slots, because you may not be the only veterinarian performing vet exams. You might be the main veterinarian, and there could be 10 other veterinarians performing exams. So you want to make sure that everybody's on the same page. You want to make sure that you let everybody know, don't skip lines, fill out every single field, and whenever possible, try to reduce the amount of pieces of paper that you have. So I like my exam forms to be double-sided. That's one less piece of paper that you have to worry about losing. And that way, if somebody just writes the date on one side and not both sides, or the animal ID number on one side and not both sides, you don't have to worry so much about losing half of your examination. Okay, we're back to looking somewhat normal. Again, on your examinations, remain objective and factual. Provide a differential diagnosis. Do not make a diagnosis without diagnostics whenever appropriate. It's a pet peeve of mine when I'm going through forensic exams and a veterinarian might have just written on their otitis. When there's no description of why they said that, there's no photographs of the ears, there's no ear cytology performed. So be thorough and make sure that if you don't make a declaration, a definitive diagnosis without diagnostics, otherwise just put a differential diagnosis on there. You want to be able to back everything you say up in court. So remember that throughout your whole exam. So document a plan and recommendations. Make sure this is communicated to the medical lead. You may be the medical lead, but if you're not, don't just come in and make a bunch of recommendations on paper and then it goes nowhere and the animal doesn't get the treatment it needs. Make sure that somebody's aware that this particular animal or animals need further care, and make sure that there's a plan in place for them. This is one of the many embedded collars that we get at work. So this collar would have been taken off, measured, documented, photographed, put into a bag, tagged, logged, and saved until the case was over with. I like taking these embedded collars and measuring the circumference of the ligature that's on the animal, and then measuring what it should have been, you know. So I think that's kind of compelling. He's fine. He went on to heal. I didn't put any pictures in here that didn't have happy endings. This is how you should photograph lesions. So this is our same little dog from the other pictures, the little skinny dog. Had a little dermatitis on the ventral abdomen. So whenever you're doing lesions, you want to take an orientation photo first so that when they're looking at it, they know exactly where your close-ups are coming from. And then you do a close-up with a forensic scale and a close-up without a scale. You can order these scales on Amazon. They come in all different sizes, and it's nice to have a bunch of different sizes of them. That's a terrible picture up there. It's kind of blurry, and so one of the reasons you're supposed to use a forensic ruler is so to minimize blurring. That's why the circles are on there and all the different colors of grayscale. Body condition score should always be used. Most of the time, well, a lot of the time when you're doing a cruelty investigation, the animals are underweight. So it's important for you to pick a body condition scoring system. I like the Purina score, it's what I'm comfortable with. But whichever score you choose, just make sure you reference the scale in your medical notes and make your determination not just by sight, but by sight and palpation whenever possible, if you can get your hands on the animal. If not, then just make sure that it's documented that it's an estimated body condition score. And then if you have to write the veterinary forensic report, make sure you include a copy of that scale in your report. Same with pain assessment. Make sure you reference the scale used and include the scale in the veterinary forensic report. I'm kind of leery about making declarations of pain unless it's really obvious. I will say pain possible or pain likely. But if their animal's not showing overt signs of pain, then I won't usually say animal is definitely painful, because you may be challenged to say, well, why did you say that? So be cautious about your wording. Diagnostics, depending on the species involved, I chose dogs and cats on this because that's what I usually see. At a minimum, on dogs, they should all have intestinal parasite screens, heartworm tests, volume total solids, if you can. That's a good minimum database. And then, of course, for kitties, it's the FELV, FIV testing, and intestinal parasite screen and volume total solids is a nice minimum diagnostic screening for all of your animals pulled from a cruelty investigation. And then, of course, additional diagnostics when indicated, including cytology, respiratory panel, parvo testing, pregnancy testing. Pregnancy testing is sometimes recommended if you've got animals that are pulled from a breeding operation. I've asked over and over again some of the top gurus in the sheltering industry about whether or not this is necessary, and I always get the same answer, that if these animals do not belong to you or your organization that you're working for, and then they may be pregnant, you probably shouldn't be vaccinating them with modified live viruses. And so I used to try to pregnancy test as many as I could. It's expensive, not every organization can afford to do it. But you need to be very, very cautious. And if you end up needing to vaccinate everybody because you've got an infectious disease outbreak and that threat is greater than the risk to the unborn puppies or kittens, then you need to make sure that that decision is very well documented, because they may end up getting their animals back. You don't know. So that's kind of a difficult situation sometimes. Fungal cultures, radiographs, CBC chem. If you're doing a dogfighting operation, Babesia testing is indicated if the organization can afford it, and then of course referral when needed. Oftentimes there's a wellness plan in place. There may or may not be. You may be the one that has to determine that. Again, you're dealing with oftentimes if it's large scale, you're dealing with a herd, you're dealing with shelter medicine, and so you want to make sure that these animals are provided some immunity. You want to make sure they're dewormed. Maybe some flea and tick preventative, when needed. Sometimes protocols will be presented to you. Please, if they are, then try to follow those protocols, because if you've got a large number of people working on the same cruelty case, you need to be consistent. If you're the one that develops the protocols, then tell everybody to stick with your protocols. And if they have a real issue with anything, to come talk to you first before just changing it. Know what drugs are available. If you're the one in charge, let everybody else know what's available so that they're not ordering medication that you don't even have in the shelter. Refer when necessary and schedule rechecks. That's very important, especially if you're dealing with a really large scale case, because if there's not a recheck system in place, animals are just going to get ignored and they're not going to have their illnesses dealt with and rechecked. So make sure that there's a recheck system in place. Referral. Again, understand the referral process. There should already be someone in mind to send animals from a cruelty investigation, especially if it's a case where the animals are being housed at an emergency shelter that's established just for this case. There should already be someone in that area who's prepared to see those animals, especially after hours or a specialty clinic when needed. Understand the legal rights at the time of referral. Anytime an animal leaves the approved facility where they are housed, if they're part of a criminal investigation, they have to be accompanied by a chain of custody form, and so you need to tell the receiving veterinarian about that form and how they sign off on it and how it has to stay with the animal. And again, if euthanasia is needed, make sure it is approved and very well documented. Step 5, the veterinary forensic report. If this is something that you are tasked with, get ready to spend a lot of time on it, especially if there are a lot of animals involved. Even one animal takes hours to do. But you want to write clearly, remain factual and objective. You want to use layman's terms because these are not going to be medical people that are reviewing this report. Include your photographs, reference relevant laws for that area, and include appropriate reference materials such as the body condition and pain scores and the reference ranges for diagnostic test results. So why should veterinarians help? I've made this all sound like a real big pain, haven't I? So it's actually a lot of fun usually, but it takes a lot of time. Of course, there's animals in need, which is the primary reason we should all help. Rescue organizations cannot do these cases without veterinarians. There wouldn't be a case without the vet's participation, and if we don't have cases, our laws will never change. So, and animal welfare laws protect more than just animals. There's a link between animal crimes and crimes against children, the elderly, and domestic violence. This is becoming more and more documented, and so we are all sort of responsible for each other. Go back to this kitty. This kitty was dragging this track down the streets of Memphis. And he's fine, his leg is fine. We named him Honey Badger, and he is now in a nice home. So there's lots of references and there's lots of resources out there on veterinary forensics and cruelty investigations. I'm in the master's program through the University of Florida right now. It's a great curriculum, and you don't have to work on a master's. You can just take one class if you want, but it is really a good curriculum if you want to learn more about veterinary forensics. I think every veterinarian should at least take some additional training, because we never know whether you're a private practitioner or a shelter veterinarian, or if all you do are cruelty investigations. You never know what's going to be brought to you, and most of us were never trained what to look for. Most of us weren't even trained to even think that way. So if you're interested in it, please look into the University of Florida's program, and also the NAVC AAHA Vetfolio offers online certification courses in forensics and crime scene investigation. And there is the International Veterinary Forensic Science Association, which is a nice association to join. The dues are not that expensive, and they have a nice conference every year with great lectures. Any questions? This is me at work.
Questions? So, first, Mary, I'm going to ask questions. So you get these situations where you have the critical dog. And what I'm struck with, and what I'd like you to go back and walk me through and the audience through, is when you're in that conundrum of it's evidence, but it's critical. And so you need to collect your evidence, but you need to get that dog off scene. So tell me about how that works for you.
Well, it's a great question, and you and I have both been in that situation. So, for one thing, you don't always know how much time you have for that animal. And so if there's any question that you don't have much time for that animal, then it's far more important to get him loaded up and transported on his way to getting critical care than it is to get those few photographs in the beginning. Documenting that exact thing is extremely briefing the veterinarian that's going to be receiving that animal on how to document for evidence, and how, like, I think you were with me on a case once where you actually accompanied a critical animal to the off-site clinic and then took your photographs, right? Yeah. So while the animal was receiving critical care, Kathy was there also getting the documentation that she needed for the criminal case. So the animal's health is always going to come first, always, So that's a great question. Did I answer it? Yeah. Yes, ma'am.
What? Is it me?
Yeah.
Okay. I'm struck by the multiple sort of groups and organizations and people that get dragged, might not be the right word, but are involved in these criminal cases, and I'm wondering about the politics or the tension or the angst that occurs, not only because you're seeing awful things, but because people may not be following the chain of command, or what may be a veterinary issue is figured out by somebody who isn't. Can you talk a little bit about that?
Yeah. So when I got my very first cruelty investigation that I got involved with was way back in 2012, and it was a cat hoarding case of 700 cats. And they'd already been moved to the temporary shelter, and I was a relief veterinarian at the time, so I would go over and just provide care a couple times a week for them. One of the best pieces of advice that was given to me, because I had never seen anything like it before, and I'll be honest with you, it was very emotionally challenging for me to see all those cats in this shelter for prolonged periods and not knowing whether or not they were going to go back to the place where they came from, or whether or not they were going to be euthanized in the end. I mean, it was really difficult, and there were a lot of hands in that pie. But one of the best pieces of advice I got from the person who told me about this situation was they don't need cowboys. They just need you to go in and follow their protocols and do what they ask you to do. And that actually was very, very useful for me to remember my place. And I think a lot of times people don't remember their place, and your place is going to vary from case to case if you get involved in, multiple cases. Sometimes you really are there just to provide medical care. Sometimes you're there to be a veterinary technician. Sometimes, but it is extremely important to follow chain of command. And if there's something that's particularly difficult for you to swallow, or you don't agree with something that's going on, then you should feel like you can go to the next person above you and discuss that, but it needs to be discussed. So I don't know if I'm really answering your question or not, but it can be extremely stressful, especially in the beginning of one of these large-scale cases, and there's so many people there. And one of my biggest challenges when I was overseeing the medical division for the field operations team was trying to have enough planning time before we actually went on scene, and that varies. I mean, sometimes you don't have much time, and the less time you have to plan, the more chaotic it's going to be when you finally get there. So it's really important if you are asked to participate, especially if you're asked to be the lead veterinarian or one of the lead veterinarians. It's very important for you to try to get the information from the organization. Who are all my players? What are their roles? What are their contact information, so that you can start touching base with them. You need to know what you're getting into, because otherwise it's like very overwhelming to see all these animals in varying states.
One of the things I see locally is that sometimes we're sort of called in at the end instead of the beginning, and it makes it real hard to step in and do the forensic part of that exam because we're prepped and we think differently than law enforcement. So there can become a high level of interpersonal stress that goes on. Plus you're battling against a time clock at that point, or I think of us as, and maybe this isn't fair, but I think of us as kind of a nerdy, very organized group of people, and law enforcement really is kind of a cowboy. No offense, Ian. But so we get a little bit of a you know, and I feel like somehow conversing, and I think if there's something that I wanted, I know Mary, obviously you guys are getting this, we work together. I wanted Mary to come in and talk very practically. What I'm struck with is there are not a lot of veterinarians in this state that have forensic background. And so we need more people who know what they're doing, or know enough that at least that an aunt comes to you and says, hey, this is Ann Burns, by the way, from Ingham County Animal Control. She's deputy director. But if she comes to me and says, hey, Kathy, I need help, I can say, okay, absolutely, here's what we're going to do. But if you go to somebody who's a private practitioner and you go, hey, I need help, they're going, I don't know what to do. And you're going, well, I don't know what to tell you because you're the veterinarian and I'm law enforcement. I know my job, but I don't know your job, right?
And when it comes down to testifying,
I don't want to testify.
They're not going to listen to me, they're going to listen to the veterinarian.
Right, and so if you're going to go in as a veterinarian, you kind of, one of the things that I found, and I bet Shereen can agree with this too, is you kind of get a little bloodthirsty yourself. It's like, I'm going to put that asshole in jail. You know, that's what you start thinking as a vet. Yeah, I'm going to do this exam right. You know, that's how I go.
Well, I've been there too, where, you know, and a lot of times when you're presented with a possible cruelty case, it's clear. Like this, you know, whether it be from the environment being just squalid and uninhabitable, or the animal themselves showing overt signs of cruelty, yeah, I mean, but and in that case, you just be honest in your medical records, you know, you don't have to embellish at all, you know, you just state what you see, you know, so, but yeah, it can be tough, but that's why I encourage people, if you have any interest at all, that if you're a veterinarian, you really should have at least a little bit of interest in what to do if you're presented with a possible cruelty case. Just, you know, take an online class or just even through VIN.
I'll just play devil's advocate here for a second. Do you ever get overzealous rescue groups? I don't mean, because some people, their perception of adequate shelter or even food, or I know a fellow got turned in my area with a German Shepherd dog with Mexican pancreatic insufficiency, and he didn't realize his dog had that, but once he got medically educated, he's like, oh, I need to supplement pancreatic enzymes, and then the dog gained weight, but he got turned in multiple times for not feeding his dog. Well, he was feeding it, or I don't know, just different things. I mean, how do you address that?
I get overzealous animal control officers all the time at work, you know, which I don't want to discourage them at all from reporting possible cruelty, but they'll bring me a request for a forensic exam sometimes, and I go and I look at the animal, and I'm like, he's lying, you know, that's all, they don't give me any background at all, so I have to go chase them down and say, why am I spending 2 or 3 hours on this one animal? I've got a whole shelter full of animals that need my care. And then sometimes they'll give me background and it'll make more sense as to why they requested that exam. Doesn't mean I'm going to find anything, you know, just document what you see. And so I guess that poor guy, you know, you just document what you know. And if he's clearly got medical records that he's taken his animal to the veterinarian, then it should be like a no-brainer. Well, you know, but yeah, I do. I get overzealous, and you know, we get rescue groups all the time around my city that are mad at us for doing things as a shelter, you know, so I'm very familiar with overzealous rescue groups.
I think the other thing too that we'll do is we'll take a dog in that's thin, you know. We'll see just basic things. We'll do some basic blood work maybe, and then you know, we will just see, will they gain weight? If we give them food, we had a dog that came in, a boxer, a couple of years ago, wasn't it? That was very thin. She came in as a stray, and it's like, okay, well, what's her deal? she wouldn't gain weight in the shelter, and we were feeding her, you know, so we knew. So you know, it's like, it's real simple. Like you feed them. I had a cruelty case where I had 9 dogs. We started feeding them, and in 2 weeks, they gained 25% of their body weight, right? So yeah, they didn't get food, right? You know, but the boxer didn't gain weight. You know, so then it's like, well, that was summer months and we couldn't get free blood at Baker. So it's like, well, she didn't gain weight, let's back it up and let's go ahead and send some blood work out. She had renal failure. You know? So she wasn't really showing a lot of clinical signs that we could detect, where a shelter would probably, if we'd really been watching her, would have seen that she was PUPD. So, you know, there are things, and you're right, you know, we get the cooks that call us at the open admission shelter. We had one last week. Oh my God, they're doing this dog, you know, we need somebody to come up. The dog had food, water, and housing. It's like, well, it's, you know, you got nothing here. Yeah, I agree, the dog should be sleeping in their bed, but it's not, you know, so.
Over here. Oh, sorry. Make the speaker. Sorry, the microphone right on. So, sorry. Tiana Thomas, Michigan State University. In my experience working as kennel staff or veterinary assistant, I've overheard some practitioners and veterinarians who, as you were saying, Michigan's not a mandated reporter state, are tempted to turn a blind eye to cases where they suspect might be cruelty or neglect. Is there anything I can do or we can do to convince our colleagues not to do that, to try to investigate or report?
Between animal cruelty and child abuse and, you know, domestic violence. And so I don't know if that will work in every situation, but then sometimes people are more compelled to report something if they think there might be some children at that same home that are suffering the same level of neglect. Other than that, I guess just try to keep gently prodding them, you know. It's a sticky situation, like if you're working, right, yeah. But if, I mean, there's nothing wrong with, and again, it's sticky if you're actually working for a practitioner and this is a client. Is that sort of the situation you're talking about?
Yeah, there's been a few situations where I will hear the veterinarians talking behind the scenes, this person should not have animals, treating them right, this is terrible, and they're afraid that they'll lose their life.
Sure. That's not uncommon at all. Yeah, it's unfortunate, and I think that's one of the reasons why states are adopting the mandatory reporting with immunity, because too many people are afraid of losing business. Again, I don't agree with that, but that is just the way it is. I'm not a practice owner, so it's easy for me to say I don't agree with that. But so I guess just try to keep, if you truly look at the situation that they're looking at and think that there's probably some true neglect going on or true cruelty going on, you might try to stay on them about it. Maybe pay attention to whether or not that particular person is coming back for their recommended rechecks. If not, then they may need to, you know, animal control may need to be called. So yeah. All right.
Anyone else? Thank you so much.
Thank you guys.